Hey everyone, today we'll be going through 75 NCLEX questions that often show up on the exam. And by focusing on these key questions, you can master the essential topics that matter most. In this way, not only you will build your confidence, but you'll also increase your chances on passing the NCLEX on your first try. So let's jump right into and get started with the first part of the two sections. We have our first set of questions here. Number one, a 68-year-old female client recently diagnosed with Alzheimer's disease, admitted 3 days ago, states, "Last night I went to a wonderful wedding party. What communication technique is the client using, and what purpose does it serve?" Is it A, the client is using confabulation to enhance self-esteem? B, the client is using perseveration to avoid attention? C, the client is using confabulation as a protective mechanism? And D, the client is using perseveration for personal benefit. The correct answer here is letter C. That is, the client is using confabulation as a protective mechanism. While this patient actually is going to use this mechanism to fill in the memory gaps with imagined events, which will help them maintain a sense of self and also avoid feelings of loss, which will serve as a protective mechanism for the ego. Now, if you selected letter A, while confabulation is used, the intent is not to enhance self-esteem, but to protect the ego. If you selected letter B, the client here is using confabulation, not perseveration, because we know that perseveration involves repeating the same responses or thought. And letter D is also incorrect because perseveration is repetitive and does not serve the purpose of self-protection or personal gain in this context. So your strategy here is to identify the difference between confabulation and perseveration. You have to eliminate those choices that incorrectly combine these concepts. Now, next item, number 2. A 28-year-old male patient is set to undergo a 24-hour urine collection due to kidney stones. What action should the nurse perform? Select all that apply. A, verify any necessary dietary and medication adjustments. B, advise the patient to urinate and discard the first sample to start the collection. C, collect all urine over 24 hours and store it in the designated container. D, place an indwelling catheter in the patient after they empty their bladder. Letter E, instruct the unlicensed assistant personnel to inform the nurse when the patient urinates. This is a select all that apply question, so you should select letters A, B, and C. Why letter A? Because dietary and also medication modifications may be needed to accurately assess urine composition. Now, if you selected letter B, that is also correct. The first urine should be discarded, starting the collection only after the bladder is emptied. Now, if you selected letter C, it's also correct because all urine produced over the 24-hour period must be collected in a special container, which is going to be iced on the outside to prevent the degradation of urine composition before the sample is sent to the lab. If you selected letter D, this is incorrect because the urine is typically collected in a bedpan or urinal, not via catheterization. If the patient is able to void, it is unnecessary to insert urinary catheter to empty their bladder. If you selected letter E, the UAP can assist in placing urine in the collection container, so they do not need to notify the nurse about every urination. So what you need to do here is to recall the standard process of doing the 24-hour urine collection, which is basically gonna have to remind yourself that this is a diagnostic test to assess the kidney function and also the metabolic processes. And this includes preparation, which will involve explanation of the procedure to the patient and to avoid certain foods, medications, or activities along with other restrictions. Now, another important aspect that you're going to educate about the patient is to make sure that they know when the start time will exactly happen after they empty their first void, or their bladder rather, and that will be discarded. And then the start of the collection will happen after that, and that's for the 24-hour period. Now, the collection process here will require collection all urine produced over the next 24 hours in the container. So that needs to be refrigerated or needs to be cooled down to prevent the changes of the composition of the urine. Now, upon the collection has been completed, want to make sure that it is included in the 24-hour period, adding the last voided urine to the container. And finally, we're going to send that container with the urine in it to make sure that we have all the correct slips, information for the appropriate testing of various substances based on the clinical indications. Now, we really need to make sure that our patient is adherent to that, and everyone in the team knows what is going on for this patient, especially if they're going to be involved with the care. So we don't miss any urine specimen during the collection period. Now, let's have our next item, number 3. In teaching the student nurses about a patient experiencing diabetic ketoacidosis, or DKA, what is the best explanation for Kussmaul's respirations? A, the kidneys generate excessive urine, prompting the lungs to compensate. B, the breathing pattern increases carbon dioxide levels in the blood. C, the respiratory rate increases to expel carbon dioxide and elevate pH levels. And D, shallow, slow breathing enhances serum bicarbonate levels. The correct answer here should be letter C. That is because the Kussmaul's respirations are compensatory mechanisms by the lungs to lower the carbon dioxide. And this will help in increasing the blood pH during acidosis. Now, if you selected letter A, this is incorrect because the Kussmaul's respirations do not relate to urine production. Rather, they are a direct response to the pH imbalance. If you selected letter B, this is also incorrect because the breathing pattern is characterized by rapid, deep breaths that help remove carbon dioxide rather than increase the carbon dioxide. Now, if you selected letter D, this is also incorrect because the bicarbonate levels are regulated by the kidneys, not directly by the respiratory system, which manages carbon dioxide levels. So when you're answering this test question, you need to recognize the physiological responses to metabolic conditions. And you need to disregard those options that relate to unrelated bodily systems when evaluating the compensatory mechanisms. Now let's have number 4. A 26-year-old male patient is NPO and receiving total parenteral nutrition through a subclavian line. What precautions should the nurse take? Select all that apply. A, administer the solution through an IV pump at the specified rate. B, monitor blood glucose every 6 hours. C, weigh the patient weekly, first thing in the morning. D, change the IV tubing every 3 days. E, document intake and output every shift. The correct answers here are letters A, B, and E. Letter A is correct because the TPN should be administered using an intravenous pump to control the infusion rate accurately. Now, if you selected letter B, this is also correct. We need to regularly monitor the patient's blood glucose because of the high dextrose content in the TPN. Now, letter E is also correct, documenting the intake and output every shift, because this will help assess for the fluid balance. Now, the other options, such as letters C and letter D, the patient should be weighed in a daily basis, not weekly. And we need to make sure that we know that if there's any instances where the patient might be retaining fluid, or maybe they're going to experience any kind of fluid overload. So that's why we need to do this daily, not weekly. Now, as far as changing the tubing, letter D is incorrect. The IV tubing will be changed, including the TPN filter, with every new bag of TPN to prevent infection due to the glucose content. And it's usually changed every 24 hours. So you remember this in order to prevent growth of bacteria and also other complications. Now let's have our next item, number 5. What should the nurse include in a teaching plan for a patient with chronic prostatitis? A. Take a warm sitz bath for 10 to 20 minutes multiple times each day. B. Sit in an elevated chair for 2 hours each day. Letter C. Drink at least 3,000 ml of fluids daily with an emphasis on tea and coffee. D. Discontinue broad spectrum antibiotics when symptoms improve. You should select letter A this time. Using a warm sitz bath can provide relief and also aid in the healing process for the patient with chronic prostatitis. If you're selecting letter B, this is incorrect because sitting for long periods is discouraged as it may increase the discomfort. And if you selected letter C, while hydration is important, an excessive intake of caffeinated beverages can irritate the bladder. So this is not indicated. If you selected letter D, broad spectrum antibiotics should be taken for the entire prescribed duration, even if the patient's symptoms improve. So this is an incorrect statement. Now, your strategy here is to understand the basic patient education regarding the use of the sitz bath. And if unsure about the hydration recommendation, remember that excessive caffeine can be harmful. Now let's have our next item, number 6. The nurse suspects delirium in a 43-year-old female client admitted in the medical surgical unit. Which assessment finding would confirm this suspicion? A. Gradual onset of disorientation. B. Fluctuating consciousness with occasional hypervigilance. C. Symptoms persisting for a prolonged duration. And D. Symptoms developing slowly over time. Your option here should be letter B. That is the answer. Because the delirium is characterized by a disturbance in consciousness, with the client's awareness shifting from hypervigilance to reduced responsiveness. If you selected letter A, delirium typically has a sudden onset, not gradual. So A is incorrect. If you select letter C, this is also incorrect because delirium usually resolves within days to weeks, unlike dementia, which is progressive and it will happen for long term. Now, if you selected letter D, this is also incorrect because the onset of delirium is abrupt rather than slow or insidious. You really need to differentiate between the onset and the progression of delirium and dementia. And as we know, that delirium often has a quick onset and it will involve fluctuating symptoms. Let's have our next item, number 7. When creating a care plan for a client with dementia, which action represents a tertiary prevention intervention? A. Encourage social activities to reduce isolation. B. Provide a consistent routine to minimize confusion. C. Consult occupational therapy to mitigate physical decline. And D. Conduct a mini mental status exam to assess cognition. The correct answer here is letter C. Why letter C? Because it's talking about tertiary prevention, and this includes actions or interventions that are aimed at minimizing the long-term effects of chronic conditions. In this case, occupational therapy can help manage and also slow down the physical decline. If you selected letter A, this is incorrect because encouraging socialization addresses a current issue, and this is considered secondary prevention. If you selected letter B, this is also incorrect because establishing a routine helps manage ongoing symptoms, also aligning with secondary prevention. If you selected letter D, this is also incorrect because cognitive assessments like the mini mental status exam are tools for evaluating current functioning, falling under secondary prevention. So your strategy here is to recognize the difference between secondary and tertiary prevention. And please be reminded that secondary prevention, the goal for this is to detect and also address existing conditions early to prevent complications or worsening of the disease. Whereas tertiary prevention, the goal here is to minimize the long-term effects of a disease or condition that has already been diagnosed and to improve the quality of life. So take note of the differences. Let's have our next item, number 8. A patient received Carboprost hemabate for uncontrolled uterine atony following unsuccessful treatment with IV oxytocin. Which adverse effects should the nurse monitor for? Select all that apply. A, diarrhea. B, palpitations. C, hyperthermia. D, edema. E, low blood pressures. The correct answers here are letters A and C. A, the medication Carboprost can often cause gastrointestinal side effects, including nausea, vomiting, and diarrhea. And the other option here or answer is letter C, hyperthermia. This is another common effect, a side effect associated with a Carboprost administration. If you selected the following letters B, D, E, those are incorrect. Letter B, palpitations. There's no established link between the Carboprost and palpitations. Generalized swelling, or known as anasarca, is not also associated with Carboprost use. And also edema, it doesn't have any relevance at all. And also with low blood pressure, it's not a common side effect of Carboprost. So your strategy here is to recall the side effects of the medication hemabate. And this is a medication that is categorized or classified as a prostaglandin that is used to control postpartum hemorrhage by acting on the uterine muscles. And the common side effects here are mostly related to gastrointestinal and thermoregulatory systems. So take note of those. Our next item, number 9. A 40-year-old male client with delirium and symptoms include sleeplessness, auditory hallucinations, and vertigo has been prescribed Meclizine antivert. Which response best indicates the medication's effectiveness? A, the client reports a decrease in auditory hallucinations. B, the client experiences uninterrupted sleep. C, the client maintains balance while walking. And D, the client's appetite improves. The correct answer here is letter C. Meclizine is effective for managing vertigo and improves balance during the ambulation. That indicates that there is effectiveness of this medication. If you selected letter A, Meclizine does not treat hallucinations. This is incorrect. Antipsychotic medications are needed to treat these hallucinations, not Meclizine. If you selected letter B, this is also incorrect. Although sleep disturbances can accompany vertigo, Meclizine does not address sleep directly. You're going to need a different medication for this one. Now, if you selected letter D, this is also incorrect because this is not intended to stimulate appetite. There's medication for that, specifically for anorexia. Alrighty, let's have our next item, number 10. A client 15 days post-delivery calls the nurse reporting a week of whitish discharge, but suddenly now has heavy bleeding soaking through a pad every 30 minutes. What is the nurse's best response? A, it's likely a return of your menstrual cycle. B, limit your activity until the bleeding stops. C, this could be due to straining during a bowel movement. D, you should go to the emergency department for evaluation. The correct answer here is letter D. This kind of bleeding requires immediate evaluation to rule out late postpartum hemorrhage or infection. If you selected letter A, this is incorrect because this is unlikely, as menstruation typically does not resume this early postpartum, especially with prior white alba discharge. If you selected letter B, this is also incorrect. While rest is generally advised, it does not address potential complications requiring medical assessment. And if you selected letter C, this is unlikely cause of sudden heavy bleeding at this stage. So your tip right now is to recognize the abnormal progression from lochia alba to heavy bleeding, which indicates a potential complication that needs urgent attention. Let's have another test item. Number 11. The nurse is educating the family of a client with schizophrenia on the importance of sticking to the prescribed medication plan. Which family statement demonstrates understanding? A, taking antipsychotic medication regularly lowers the chance of relapse to about 30%. B, once stabilized, there's still a high chance of relapse even with regular medication use. C, since schizophrenia is complex, antipsychotic medication doesn't greatly impact relapse prevention. Letter D, given schizophrenia's chronic nature, antipsychotic medications have minimal influence on reducing relapses. Your option here should be letter A, because taking antipsychotic medication regularly lowers the chance of relapse to about 30%. And according to research, consistent use of the antipsychotic medication can reduce the relapse rate to about 30% for all patients with schizophrenia. Now, if you selected letter B, while relapse is possible, regular medication significantly can reduce the relapse rate, which is contrary to the statement suggesting a high chance of relapse despite medication. If you select letter C, this is also incorrect. Although schizophrenia is complex, antipsychotic medications are very important for managing the symptoms and also reducing relapse rates when consistently taken. Now, if you selected letter D, this is incorrect. Schizophrenia is chronic, but antipsychotic medication adherence has a proven effect on lowering relapse rates, which is contrary to the statement as well. Now, your strategy here is to focus on understanding that consistent use of antipsychotic medication can lower relapse rates in schizophrenia. Even without knowing the specific percentage, recognize the role of the medication adherence in preventing the relapse. Now let's have our next item, number 12. A nurse is reviewing neonatal blood screening tests with a new mother. Which conditions, when identified by the mother, indicate an understanding of what the screening tests assess? Select all that apply. A, galactosemia. B, hypothyroidism. C, cystic fibrosis. D, cerebral palsy. E, sickle cell disease. The correct options here are letters A, B, C, and E. We know that galactosemia is a genetic disorder where the body cannot metabolize galactose properly, and newborns are routinely screened for this one. If you selected letter B, this is correct as well, because specifically congenital type of hypothyroidism is present at birth, and this can lead to developmental delays if untreated. It is also screened across all the states. Now, if you selected letter C, cystic fibrosis, which is a genetic disease affecting the mucus consistency in organs, is also a standard screening item in the newborn blood panel. Now, if you selected letter E, sickle cell disease, which is a blood disorder and impact the red blood cell shape, is commonly screened. So the correct or the incorrect answer rather is letter D. That's not part of the neonatal blood screening test because this condition results from brain injury, which happens during delivery, and it is identified through physical examination, not blood screening. So your strategy here is to focus on identifying congenital or metabolic disorders typically screened for newborns rather than conditions diagnosed via physical examinations. Number 13, a patient has returned from transurethral resection of the prostate, TURP, and is exhibiting a pulse of 108 beats per minute, respiratory rate of 22 cycles per minute, blood pressure of 92/42 mmHg, and cool, clammy skin. What action should the nurse take? Select all that apply. Is it A, examine the urine in the continuous irrigation drainage bag? B, reduce the amount of irrigation fluid in the continuous irrigation catheter? C, lower the head of the bed and elevate the foot of the bed? D, inform the surgeon about the patient's current status? E, assess the patient's post-op creatinine and BUN levels. Take note about the abnormal assessment findings. You should select the following options. These are the correct answers. Letters A, C, and D. Letter A is a very important step because after a TURP, the continuous irrigation is used to keep the bladder clear of blood clots and debris. So by examining the urine output, you will be able to determine if there's an adequate drainage and if the urine is in bright color. For instance, bright red or dark red urine, this indicates bleeding. So you want to ensure that the irrigation is working effectively to prevent clots, which can further complicate the situation. So you need to monitor the urine output to help you assess the patient's kidney function and fluid status as well. Now, if you selected letter C, this is a correct option because lowering the head and raising the foot of the bed can help redirect the blood to the central circulation. When you're going to lower the head of the bed and elevate the foot, you're actually promoting venous return to the heart, and this can help increase the blood flow to the central circulation, and it will help stabilize the blood pressure, improving perfusion to the vital organs. It is a very quick and effective method to help a patient who is hypotensive and who is at risk of or as at risk for shock. Now, if you selected letter D, the surgeon should be notified of any changes, especially in this type of state. If there are any significant changes in the patient's condition, especially after a surgical procedure, you must inform the surgeon right away. They need to be aware of any potential complications that could arise from the surgery or anesthesia, because we know that prompt reporting will allow us to treat our patient timely, which is very critical in managing the patient's health. So if you selected letters B and E, those are incorrect options because B, given the patient is showing signs of hemorrhaging, the irrigation fluid should be increased, not reduced, in order to flush out any red urine. If you selected the letter E, this is also incorrect because assessing the blood urea, nitrogen, and creatinine focuses on kidney function rather than addressing the immediate circulatory issues. Our issue here is about circulation. Take note of the patient's blood pressure and also the clammy skin, right? And also the increase in the patient's respiratory rate of 22 cycles per minute. This is a compensatory mechanism of the body due to a decrease in the perfusion and also with a tachycardia of 108 beats per minute. Don't forget those subtle signs of hypotension and shock. Let's have our next item, number 14. A patient with advanced liver failure has been admitted with hepatic encephalopathy. Which dietary change should the nurse enforce to manage this condition? A, limit sodium intake to 2 grams per day. B, restrict fluid intake to 1,500 mLs per day. C, reduce daily fat consumption. And D, lower protein intake to between 60 to 80 grams per day. Take note of our case scenario. This is on a patient with hepatic encephalopathy. What is the answer here? Well, it's going to be letter D. First thing, it is very important for you to understand what hepatic encephalopathy is, which is a condition that can happen when the liver is unable to effectively remove the toxins from the bloodstream, particularly ammonia, which is a byproduct of protein metabolism. And in a healthy liver, ammonia is readily converted into urea and then will be excreted by the kidneys. However, in such a case like what we have in our scenario, in a case of liver failure, this process is impaired, which can lead to an accumulation of ammonia in the blood, which can affect brain function, and it will lead to symptoms like confusion, altered consciousness, and even coma. Now, let's talk about why letter D. Because when we are lowering the protein consumption, you're effectively reducing the amount of ammonia being produced, and this can help decrease the levels of ammonia in the bloodstream. Thereby, we're mitigating the symptoms of hepatic encephalopathy. It's about managing the source of the problem because too much ammonia can lead to more symptoms. So by controlling the protein intake, we can also help the patient stabilize. So if you selected options letters A, B, C, A is incorrect because sodium restriction is primarily aimed at managing ascites and edema, not hepatic encephalopathy. B is also incorrect because fluid restrictions are generally considered in patients who are experiencing significant fluid retention or are on diuretics. If you selected letter C, this is also incorrect because patients with liver disease often have increased caloric needs due to the malnutrition and the energy demands of liver function. Instead of cutting fat, the focus should be on ensuring the patient gets enough energy to support their recovery. And so for you to effectively answer this test question, it's very helpful to eliminate those options that do not directly relate to the management of hepatic encephalopathy. So recognizing that sodium and fluid management are more relevant to fluid balance rather than ammonia levels can help you zero in on the importance of protein metabolism in this context. So what we need to do here is to reduce protein intake, and that is the key dietary change that we should be doing in this case. Let's have our number 15. The nurse is caring for a 62-year-old female patient who is 4 hours post-op following an open cholecystectomy. Which finding requires the nurse's immediate action? A, absence of bowel sounds in all quadrants. B, T-tube drainage is 60 mLs of green liquid or fluid. C, urine output is 100 mLs over the past 3 hours. D, the client refuses to turn. D, breathe and cough. identify the problem here, and that is letter D. After the surgery, especially when a patient undergoes abdominal surgical procedures like an open cholecystectomy, they are going to be at higher risk to developing respiratory complications. So when patients are not encouraged to turn, deep breathe, and cough, they can develop atelectasis, or what we call as lung collapse, really fast, or even pneumonia. And so these two complications can happen because when patients remain still for a prolonged time, the fluids in the lungs can accumulate and the air sacs will become deflated. And this can lead to the decreased oxygen levels and more significant respiratory distress. So when the nurse in this scenario notices that the patient is refusing to participate in these activities, it is already an immediate red flag. It suggests that the patient may not be aware of the importance of these actions, or they might be feeling too uncomfortable or in pain to comply. Either way, it becomes very critical for the nurse to intervene promptly. Now, if you selected the following options, A, B, C, these are incorrect answers. A, absence of bowel sounds in all quadrants. This is common for bowel sounds to be absent right after abdominal surgery because of the anesthesia and also the manipulation of the intestines. So the bowel function typically returns gradually over the first few days post-op. And again, this finding is not unusual at this stage, so it doesn't really warrant immediate action. Now, if you selected letter B, this is incorrect. The reported drainage is within the normal limits for this procedure. It indicates that the T-tube is functioning properly. There's no indication there's a problem. Now, if you selected letter C, this is also incorrect because the output of 100 mLs in 3 hours is adequate. We know that the minimum urinary output hourly is 30 mLs. So this means that the patient is having adequate, appropriate hydration and also adequate kidney function. So there's no immediate action necessary for this option. So I really want you to recognize those normal post-op findings such as urine output, bowel sounds, and also to prioritize interventions for actions that will pose immediate risk to the patient's recovery. Let's have our next item, number 16. An adult female client who has undergone abdominal perineal resection is about to be discharged. What information should the nurse provide? A, the stoma should appear white, blue, or purple. B, restrict movement to keep the pouch from detaching. C, take pain medication when the pain rating is an 8. D, the pouch should be emptied when it is 1/3 to 1/2 full. The answer here is letter D. The pouch should be emptied when it is 1/3 to 1/2 full to avoid overloading the seal and risking leakage. So the other options, A, B, C, these are all incorrect. A, being stoma, should be light to medium pink. So whatever is described here, white, blue, or purple, these indicate compromised circulation, and this is an emergency. Right? This will require a revision by the surgeon, so they need to be notified about this. If you selected letter B, this is also an incorrect option because the stoma should be secured well enough for the client to move normally. And ambulation should be encouraged for recovery, not restrict movement. That makes this statement wrong. If you selected letter C, pain medication should ideally be taken before the pain intensity reaches a 5 in order to ensure a timely relief. So your strategy here is to remember the normal stoma color indicating health, and also involved is the mobility, which is very essential post-surgery to prevent the complications. So I really want you to go back into the concept of the mobility of the patient after surgical procedures. Okay. Now let's have our next item, number 17. A nurse is caring for a 64-year-old male patient with a septic shock. After administering IV ceftriaxone at 10, the healthcare provider ordered daily IV vancomycin at 12. What should the nurse do next? A. Give the vancomycin within 2 hours. B. Contact the healthcare provider and question the antibiotic order. C. Plan to administer the vancomycin at 2100. And D. Check the patient's white blood cell count. Your patient here is in septic shock. You should select letter A, because administering the vancomycin promptly is very critical in a case such as septic shock. And we know that ceftriaxone provides a broad spectrum coverage until the specific pathogen is identified. And vancomycin, in this case, can target the specific bacteria and should be given as soon as possible to improve patient outcomes. Now, if you selected letters B, C, and D, these are incorrect, because for B, there is no reason to question the healthcare provider's order for vancomycin, because it is appropriate treatment for septic shock. And if you selected letter C, delaying the administration of vancomycin until 2100 would not be acceptable as well. This is going to delay and will harm the patient. And letter D, while monitoring the white blood cell count is important, it does not really affect the immediate need to administer the vancomycin. So you need to prioritize interventions based on the urgency of the situation and the potential impact on patient outcomes. Let's have number 18. A 27-year-old female patient is struggling to sleep due to pain. What is the most appropriate goal for this patient? A, the patient will experience 4 hours of uninterrupted sleep. B, the patient will report feeling rested upon waking. C, the patient will request less pain medication overnight. And D, the patient will receive a back massage every evening before bed. Your answer here should be letter B. The goal of feeling rested upon waking up is a subjective assessment that accurately reflects the effectiveness of sleep quality and quantity. So if you selected either A, C, or D, these are incorrect options, because 4 hours of sleep is insufficient for most adults, who generally require 6 to 8 hours of optimal sleep. And if you selected letter C, this is also incorrect, because requesting less pain medication does not equate to effective sleep or pain management. And letter D is also incorrect, because while providing back massages may enhance the relaxation, it is not the definitive goal related to sleep quality. So let's proceed to our next item, number 19. A nurse is assessing a newborn's pain after a circumcision using the Neonatal Infant Pain Scale, or NIPS. Which observations are part of this assessment? Select all that apply. A, temperature. B, blood pressure. C, breathing pattern. D, heart rate. E, facial expression. The correct answers here are letters C and E. Letter C, breathing patterns, are a very essential part of the NIPS assessment, because when a newborn is in pain, their breathing may become irregular or rapid. So for instance, you might notice changes like shallow breaths or even grasping. So these are irregularities which will indicate distress and also pain, making it very crucial for nurses to observe them carefully. Now, if you selected the letter E, this is another correct answer. Facial expressions are another critical element of the NIPS. We know that newborns may not be able to verbalize their discomfort, but their faces can reveal a lot. So you're going to look for furrowed brows, tightly closed eyes, or grimacing. These are signs that indicate that a baby is in pain. Now, if you selected letter A, this is incorrect because temperature is not part of the NIPS. While we know that temperature is important for assessing the overall health, it is not a specific component of this NIPS. Um, Pain assessment can focus more on the behavioral cues rather than physiological measurements like body temperature. And if you selected letter B, this is incorrect. Blood pressure is not included in the neonatal pain assessments. Same thing with letter D, although sometimes that the heart rate can increase, but it's not part of the NIPS. The heart rate can sometimes provide a clue about patient's pain level, but it's not specific to this kind of assessment tool because the heart rate can vary widely based on so many other factors, maybe due to activity, it could be environment, and even the baby's state of alertness can also affect the heart rate. So you need to review the NIPS components, focusing on the behavioral cues such as breathing and facial expressions. Let's have our next item, number 20. The nurse is preparing to discharge 5 Rh negative clients from the maternity unit. Which clients would require RhoGAM administration? Select all that apply. A, 16-week amniocentesis. B, delivery of Rh negative twins at 35 weeks. C, 10-week spontaneous abortion. And D, fetal loss at 24 weeks. And E, birth of an Rh positive baby at 40 weeks. The correct answers here are letters A, C, D, and E. Letter A, because when a mother undergoes an invasive procedure like amniocentesis, this is going to put them at risk for the mixture of the maternal and fetal blood. And since this procedure occurs at 16 weeks, the fetal blood type might not be known yet. And so administering RhoGAM is very important to protect the mother from developing antibodies against Rh positive blood if any fetal blood cells enter her circulation during the procedure. This is a preventive measure to ensure the mother's immune system doesn't react negatively in future pregnancies. If you selected letter C, this is also a correct option. In this case of a spontaneous abortion or miscarriage at any gestational age, RhoGAM should be given if the blood type of the fetus is unknown. This is because there is a potential for Rh positive fetal cells to enter the maternal bloodstream, which could sensitize the Rh negative mother. And so, administering RhoGAM can help prevent the development of antibodies that could affect future pregnancies. Now, if you selected letter D, fetal loss at 24 weeks, similar to the loss of fetus at 24 weeks, the same principles apply because the risk of Rh sensitization still exists, and RhoGAM should be administered to an Rh negative mother. And so this can also help mitigate any potential issues that might arise in the subsequent pregnancies, ensuring that the mother's immune system remains compatible with future Rh positive babies. Now, letter E, this is also a correct answer rather, birth of an Rh positive baby at 40 weeks. Because when an Rh negative mother gives birth to an Rh positive baby, again, RhoGAM administration is critical. This actually presents a very higher risk of sensitization since the mother's blood may mix with the baby's blood during the delivery. And so you need to administer RhoGAM within 24 hours of birth to protect the mother from forming the antibodies that could attach Rh positive red blood cells in any future pregnancies. So to prevent hemolytic disease of the newborn. Now, if you selected letter B, this is incorrect because Rh negative infants do not produce Rh antigens. Therefore, RhoGAM is not needed for Rh negative deliveries. Okay. Again, you need to remember that RhoGAM is administered when there is potential Rh antigen exposure, which occurs with Rh positive fetuses or invasive procedures during pregnancy. Let's have another item, number 21. To help prevent hypoglycemia in a healthy full-term newborn weighing 2,900 grams, the nurse should prioritize which of the following interventions? A, feed the infant glucose water every 3 hours until breastfeeding regularly. B, maintain the infant's temperature above 97.7 degrees Fahrenheit, 36.5 degrees Celsius. And C, encourage the mother to breastfeed every 4 hours. And D, check blood glucose every 3 hours for the first 12 hours. The correct answer here is to select letter B. That is, maintain the infant's temperature above 97.7 degrees Fahrenheit. Because when you're maintaining a stable body temperature, it can prevent hypothermia, which can trigger hypoglycemia due to increased energy use. And so if you selected letters A, C, and D, these are incorrect options. A, glucose water is not necessary for healthy newborns because breast milk or formula, these are our priority nutrition at this time. If you selected letter C, this is also incorrect. Breastfeeding should ideally occur every 2 to 3 hours, not every 4 hours, to maintain stable glucose levels. If you select letter D, this is incorrect because routine blood glucose checks are not required for healthy full-term infants without other risk factors. Let's have our number 22. A 12-year-old child has been admitted to the ICU due to a zolpidem overdose. A whole bowel irrigation has been prescribed. What should the nurse implement? A, give 0.5 liter of polyethylene glycol with electrolytes every hour. B, give 1.0 liter of PEG with electrolytes every hour. C, give 1.5 to 2 liters of PEG with electrolytes every hour. And D, give 2.5 to 3 liters of PEG with electrolytes every hour. Take note of the patient's age, 12 years old. Your answer here should be letter C. When you administer 1.5 to 2 liters of PEG with electrolytes, we call that go lightly. This is the recommended dose for patients age 12 years and older. And so the whole bowel irrigation is useful after ingestion of a certain substance, including lead, could be lithium, iron, sustained release medications. Now, the rest of the options here, A, B, and D, those are incorrect. Letter A specifically, this is appropriate for children under 6 years old. That's little amount, 0.5 liters of the Go Lightly. If you selected letter B, this is also incorrect. 1 liter of PEG. This is intended for patients age 6 to less than 12 years old. And if you selected letter D, this dose exceeds the safe limits and it's not recommended for any patients. This is way too much. Let's have our next item, number 23. A 36-year-old male client undergoing treatment with plant alkaloid anti-neoplastic medications reports increased clumsiness, stating he can't even pick up a dime. How should the nurse respond? A, this is a typical side effect and will resolve once your treatment is finished. B, don't worry, this is just a minor side effect of the medication. C, have you noticed any changes in your bowel habits? And D, do you feel weak or dizzy when trying to stand? Your answer here should be letter C. Because chemotherapy-induced neuropathy can affect not only the peripheral motor function, but it can also affect the autonomic nervous system, which can control the involuntary functions like bowel movements. So If the chemotherapy is damaging the nerves, it could also impact the bowel function, which can result in symptoms such as constipation or maybe changes in the bowel habits. And so if you're the nurse here asking about the bowel habits, you're actually doing a comprehensive approach to assess the extent of the potential nerve damage caused by the medication. So if you selected the other options, letter A, B, and D, these are incorrect. Letter A, this nurse response actually minimizes the patient's concern and it dismisses the seriousness of the symptom. This issue is not normal, and this might indicate development of neuropathy, which might not resolve after the treatment ends. Now, if you selected letter B, this is also incorrect. Similar to option A, this nurse's response to the patient also downplays the reported symptom because clumsiness is not minor, and it also indicates that there are significant complications that need to be addressed. Now, if you selected letter D, this is also incorrect because while dizziness can occur, it is not a common side effect of plant alkaloid medications. So, your strategy here to answer this test question is to recognize that plant alkaloids such as vincristine or vinblastine, these medication can lead to neurotoxic side effects, including peripheral neuropathy. And you need to also understand the specific medications being used in order for you to have a much better safe response. Now, let's have another test item, number 24. A patient with emphysema is admitted to the surgical unit for a cholecystectomy. What post-op action should the nurse take? Select all that apply. A, encourage the patient to turn, cough, and take deep breaths every 2 hours. B, provide oxygen therapy at 4 liters per minute to the patient. D, or letter C, examine the surgical dressing every 4 hours. D, administer morphine 15 milligrams IV push regularly. E, instruct the patient to use the incentive spirometer every 4 hours. Your selection should be letters A and letter C. For A, this patients recovering from the surgery are advised to perform turning, also coughing, deep breathing exercises at least every 2 hours. And for those people with emphysema, they may need to do this more frequently than a normal person in order to maintain airway clearance. Now, letter C is also correct because patients with chronic lung conditions often receive long-term steroid therapy, which can also impair wound healing. And so regular assessment of the surgical site is very important to ensure that it is healing properly. Now, if you selected the other options, B, D, and E, these are all incorrect. Why incorrect for letter B? The oxygen should typically be provided at lower levels, especially that our patient has emphysema. So it's safe to administer at a rate of 1 to 3 liters per minute for this type of patients. And this is to avoid toxicity and also to avoid respiratory distress from excessive oxygen. Now, if you selected a letter, hang on a sec. Looks like we shifted to another option. Okay, so if you selected letter C, that is one of the correct answers, right? If you selected letter D, rather, administer morphine 15 milligrams IV push regularly, this is incorrect because the regular administration of 15 milligrams morphine is unusually high, and this can lead to adverse effects such as hypotension. It can also lead to sedation and respiratory depression. And we know that when it does cause these issues, especially with a patient that has emphysema, they're already at risk for respiratory complications. So we need to be cautious in administering the medication and make sure that we are administering lower doses according to the prescription, and also to make sure we monitor the respiratory status closely. Now, if you selected letter E, instruct the patient to use the incentive spirometer every 4 hours. This is incorrect. We know that this is important to do, right? But since the case of our patient, this patient has emphysema, the recommended frequency should be more than every 4 hours for this kind of patients to prevent these respiratory complications. So take note about the factor here, which is the emphysema. So they need to do the incentive spirometer exercises more often than every 4 hours. Let's have another question. Number 5. An adult male patient is in ventricular fibrillation. Which intervention should the nurse implement? Select all that apply. A, start cardiopulmonary resuscitation. B, prepare to administer adenosine IV push. C, get ready to defibrillate the patient. D, bring the crash cart to the patient's location. E, prepare to give amiodarone IV push. Your answers here should be letters A, C, D, and E. Letter A, when you're going to see a patient in ventricular fibrillation, they lack that effective heartbeat, which means the blood isn't circulating to the vital organs. So you need to start the CPR because it can maintain the blood flow to the brain and other organs until the defibrillator is available. And the CPR here can provide some oxygenation, and it can buy time for the heart to be restored to a normal rhythm. Now, another correct option here is to select letter C, get ready to defibrillate the patient, because this is the most effective treatment for ventricular fibrillation. It delivers a shock to the heart, which can actually reset the electrical activity, and it can also restore a normal rhythm. So the sooner defibrillation is performed, the better the chances are of survival, making this intervention a top priority. Now, if you selected letter D, bring the crash cart to the patient's location, we know that this is an equipment, or the crash cart itself contains all the essential equipment needed for the ACLS interventions. So that's part of our option here, or answer. Now, also letter E, prepare to give amiodarone IVP. It is also appropriate in this case because this is effective in treating ventricular dysrhythmias, including ventricular fibrillation. And it is very important to have this medication ready, as it can be administered after defibrillation attempts if the ventricular fibrillation persists. We know with ACLS, the epinephrine is the first drug of choice. Okay, this can be given every 3 to 5 minutes. However, if epinephrine is not effective, the next medication in the algorithm is going to be the amiodarone 300 milligrams. And so that's why we include letter E as one of our correct options. Now, if you selected letter B, this is incorrect. Adenosine is used to treat certain types of tachycardia, specifically SVT, or the supraventricular tachycardia. And so this is not appropriate for ventricular fibrillation because the VFib is a disorganized, and it's also an ineffective heart rhythm requiring defibrillation rather than adenosine. Alrighty, let's have our next item, number 26. A healthcare provider orders an IV infusion containing potassium for a 20-year-old male patient with a serum potassium level of 3.0 milliequivalents per liter. What is the most critical nursing action before starting this infusion? A, measure the depth of any edema present. B, evaluate the patient's blood pressure. C, assess the patient's skin turgor. D, check the patient's urinary output. The option that you should select is letter D. It's very important to determine first the urinary output before you administer the potassium, because if there is an impairment in the kidney function, such as in oliguria, this can lead to dangerous potassium accumulation, which can cause cardiac issues. So make sure that your patients urinary output is corrected first, meaning we need to correct first the hydration status of our patient. All right, never administer it up until their urine output improves. Now, if you selected letters A, B, and C, these are incorrect options. Assessing the skin turgor is not directly relevant to potassium administration. It primarily assesses hydration status. If you selected letter B, evaluate the patient's blood pressure. We know that this is essential, along with the heart rate and rhythm. Um, but again, the intervention here that you should be doing, or the assessment that you should do here, is to actually assess for the heart rate and the rhythm, to check if there is any cardiac dysrhythmias, right? It is much more pertinent rather than the blood pressure. Now, if you selected letter C, assessing the patient's skin turgor, this is not really necessary for potassium administration, and it pertains more to fluid volume assessment. So, first thing that you should need to do here is to realize that our patient has hypokalemia 3.0. And we know that potassium is very important in a lot of things, especially in the body, especially that this is needed for the heart function. So understanding what low potassium means is a key to making the right decisions in this case scenario. Now, when it comes to giving potassium through an IV, the biggest concern here is the potential for cardiac complication. That is because rapid changes in the potassium levels can seriously affect the heart. And this is why we need to be extra vigilant about assessing the kidney function and checking the urine output. And we know that the kidneys play a vital role in getting rid of excess potassium. So if they are not working well, given or giving the potassium can lead to unintended accumulation of this electrolyte in the bloodstream. Now let's have our next item, number 27. A 38-year-old female patient with ovarian cancer underwent a hysterectomy with bilateral salpingo-oophorectomy and surgical debulking 2 days ago. The patient reports abdominal pain rated at 5 on a 0 to 10 scale. What should the nurse do first? A, offer a calming back rub. B, reposition the patient. C, implement distraction techniques. And D, administer the ordered pain medication. The correct answer should be letter D, because in this situation, the administration of that ordered pain medication is of highest importance. Imagine that this is a major abdominal surgery. And if they're telling you, if the patient is telling you that their pain level is 5 out of 10, this indicates moderate pain. And we know that pain control not only improves the patient's experience, but it can also facilitate healing and mobility. The more that their pain is controlled, the more that they're going to be able to participate with those post-surgical exercises like deep breathing and coughing and deep breathing exercises. Now, if you selected those options A, B, and C, these are incorrect. Letter A, a back rub, is more suitable for mild pain, and it will not adequately address severe pain or moderate pain. If you selected letter B, repositioning, it may help mild pain, but it's not sufficient for managing moderate pain as well. And the same thing with letter C. Distraction techniques may also assist mild pain, but is not effective in treating the moderate pain. Let's have our number 28. A nurse is designing an education program for a 42-year-old male patient diagnosed with obstructive sleep apnea. What key point should be included in the discussion? A, using the prescribed device to maintain airway patency. B, sleeping with 2 pillows under the head. C, asking for a sedative to aid sleep. And D, sleeping in the supine position. Your answer here should be letter A. The best key point to include in the education program for a patient with obstructive sleep apnea, or OSA, is the importance of using the prescribed device. Typically, the continuous positive airway pressure, we call that a CPAP machine, in order to maintain airway patency. And this device works by delivering continuous stream of air that will help the airway open when the patient is sleeping. So for someone with obstructive sleep apnea, this machine is very essential in preventing airway blockages, which can lead to breathing interruptions, and also significantly can improve their quality of sleep. So when you're educating the patient on the correct use and the benefits of the CPAP, this will help them understand how to properly use this device in order for them to maintain their health and well-being. Now, if you selected letters B, C, and D, these are all incorrect. If you select B, sleeping with two pillows under the head, while many people might think that elevating their head will help, but this can actually have an opposite effect for someone with obstructive sleep apnea, because elevating the head can constrict the airway, making it more difficult to breathe. And if you selected the letter C, asking for a sedative to aid sleep, we know that sedatives can relax the throat muscles, so it can also increase the risk of airway obstruction. So as much as possible, this should be avoided. And letter D, sleeping on the back or in the supine position, can also worsen the obstructive sleep apnea, because it can increase the likelihood of airway obstruction, because the gravity can pull the tongue and also the soft tissues of the throat backward, and this can also block the airway. And patients are usually encouraged to sleep on their side. Take note, they should be encouraged to sleep on their side instead, as it can reduce the risk of airway collapse. Let's have number 29. A 63-year-old female patient has been in the intensive care unit for 3 days. What common adaptation indicating ICU psychosis related to sleep deprivation should the nurse look for? A, hypoxia. B, delirium. Lethargy for C, and D, dementia. The correct answer here is letter B. That is delirium. So, in this context of a 63-year-old female patient in the ICU for 3 days, the most common adaptation to look for here is indicating ICU psychosis, which is related to sleep deprivation. That is delirium. And so this is a condition that is often characterized by confusion, altered mental status, and also difficulty focusing or maintaining attention. And ICU psychosis frequently occurs due to the environment stressors. It could be the noise, the bright lights, and frequent interruptions, and combined with the lack of normal sleep patterns. And so when patients experience such disturbances, it can lead to acute delirium, which is a temporary state of confusion and also cognitive dysfunction that can resolve once the underlying causes like sleep deprivation are addressed. So if you selected the other options, A, C, and D, these are incorrect. We know that A, hypoxia, is associated with sleep apnea, not directly with ICU psychosis. C is also incorrect, because lethargy can indicate sleep deprivation. It does not specifically point out to ICU psychosis. And D, dementia, is characterized by chronic cognitive decline. It's not short-term confusion, okay? And your strategy here instead is, when you're assessing a patient in the ICU for signs of ICU psychosis due to sleep deprivation, you got to identify that delirium. This is the adaptation that you need to look for. Alrighty, let's have our next item, number 30. During a newborn exam, which steps should the nurse take to assess for developmental dysplasia of the hip, or DDH? Select all that apply. A, place the baby in a fetal position. B, compare the lengths compare the leg lengths rather. C, palpate the trochanter while rotating the hip. D, hold the baby's thighs and gently adduct and abduct. And E, position the fingers over the inner thighs. Your answer should be the following letters B, C, D, and E. Okay. Why letter B? Compare the leg lengths. This step is very important because one of the signs of the DDH is differences in the leg lengths. So when you're comparing the lengths of their legs, you're going to identify any asymmetry that may indicate a hip dislocation or instability. So if the one leg appears shorter, it could suggest that the hip joint is not properly positioned, which is an important finding to note. If you selected letter C, palpate the trochanter while rotating the hip, we know that palpating the greater trochanter while gently rotating the hip allows you to feel for any abnormalities. So if there is a dislocation or maybe a subluxation of the hip, this method will help identify this problem. And so the trochanter is an important landmark on the femur, and its position can also indicate whether the hip is stable or not. If you selected letter D, that's another correct answer. Hold the baby's thighs and gently adduct and abduct, because this technique is known as the Barlow's and Ortolani's maneuvers. And this is done by gently moving the thighs in and out, or adduction and abduction. And here, you as the nurse can assess the stability of the hip joint as well. So if the hip pops in or out of the socket during the movement, it's a sign of dysplasia. And so this step is also essential for evaluating how well the hip is positioned in its socket. Now, if you selected letter E, this is also correct. When you're placing your fingers over the inner thighs, it will allow you to better control. And also, you will have sensitivity during the assessment. And this positioning will also help you feel for any signs of instability or displacement while you're performing the hip maneuver. So this can also ensure that the movements are controlled and that the nurse can detect any abnormal findings more effectively. If you selected letter A, this is incorrect because the proper position for assessing the hips in the newborn is supine, not fetal position. You got to lay the baby on their back to allow better view and also to access the hips and also the legs for evaluation. If you're putting them in a fetal position, this can obscure the hip joints and it will be so difficult and challenging for you to perform the necessary assessments that I had mentioned. Let's have our next item, number 31. For an elderly client with dementia, which secondary prevention interventions should be included? Select all that apply. A, use nonverbal cues like pointing and touching items. B, simplify the environment by reducing excess items. C, offer hospice or ethical consultations as needed. And D, place a clock and calendar in a visible location. And E, discuss potential family risks for dementia. Your answers here should be letters A and D. We know that reinforcing communication with nonverbal cues and using visual aids like a clock and a calendar can help assess or address rather the current cognitive impairments of this patient. So this will qualify them as secondary prevention intervention. So if you're doing letter B, simplifying the environment by reducing excess items, this is going to help prevent the injuries, but it does not specifically address cognitive symptoms. If you selected letter C, hospice consultations are tertiary interventions that are aimed to advanced stages of illness. If you selected letter E, This is incorrect because educating family members about genetic predisposition is part of primary preventions. So your options here are supposed to be letters A and D. You got to understand the distinctions between the primary, secondary, and tertiary prevention, especially in focusing interventions directed in addressing the current symptoms or the patient's risks. Let's have number 32. A nurse is preparing to give dopamine to a 26-year-old patient with cardiogenic shock. Which actions should the nurse take? Select all that apply. A, ensure the patient is on a cardiac monitor. B, check the blood pressure every 20 minutes. C, review the intake and output every hour. D, advise the patient to report any burning sensation at the IV site. And letter E, monitor the patient's neurological status every hour. The correct answers here are letters A, C, and D. Letter A, you got to put your patient on a continuous cardiac monitoring device while they are receiving dopamine to track their heart function and also their response to the treatment. And letter C is another correct option. Hourly assessment of the urine output is very critical to ensure that there's adequate renal perfusion. And our goal here is at least 30 mLs per hour. Okay, we know that dopamine is a medication that will promote perfusion to the kidneys. Now, the other option here would be letter D, advise the patient to report any burning sensation at the IV site. The patient here should immediately report burning sensation in their IV site because it can lead to other complications. They need to report right away to prevent the complications, rather. The other options, letters B and letter E, are incorrect because what you should do here is to check the blood pressure every 5 to 15 minutes during the dopamine administration because of its effect on the cardiovascular status, not every 20 minutes. If you selected letter E, this is also an incorrect answer. Monitor the patient's neurological status every hour. This is not specifically necessary every hour because this is not directly affected by the cardiogenic shock. Okay, so your focus here is to get into the critical aspects of patient monitoring and also the management when administering this dopamine. Let's have another answer, which is number 33. The nurse is caring for a 58-year-old male patient who has been admitted to the medical surgical unit with a bleeding duodenal ulcer confirmed by endoscopy. Which collaborative actions should the nurse take? Select all that apply. A, conduct a thorough pain assessment. B, frequently check the client's vital signs. C, administer a proton pump inhibitor through IV. D, obtain an order to administer packed red blood cells. And E, track the intake of a soft, bland diet. Your answers, I should say, should be letters C and D. Why letter C? Because this intervention is collaborative. It requires a healthcare provider's order. We're talking about the proton pump inhibitor, IV. If you selected letter D, administering blood products also require an order from a healthcare provider. All right. Our incorrect answers here are letters A, B, and E. Conducting a thorough pain assessment is an independent action the nurse can do regularly. If you selected letter B, frequently check the client's vital signs. This is also an independent task. You can check the patient's blood pressures and should be taken in various positions as well to check for possibly orthostatic changes, but not during the acute stage. Letter E, tracking or monitoring the patient's diet would, actually this option here, track the intake of a soft bland diet. This diet actually requires a healthcare provider's order because most of the time, this patient should be kept NPO, looking into the patient's scenario, bleeding duodenal ulcer. This is already confirmed by endoscopy. Um, E is not going to be a intervention that is expected in this case scenario. So again, your task here is to pay attention into keywords like collaborative, independent, as this will help you determine whether an action is going to need a doctor's order or a physician's order, or it could be an independent nursing action. Okay, let's have our next item number 34. What assessment finding suggests that an adult male patient with reactive airway disease is effectively managing their condition with medication? A, the peak expiratory flow rate, or PFR, is above 80% of the patient's best result. B, lung sounds are clear bilaterally, both front and back. C, the patient has experienced 3 asthma attacks in the past month. And D, the patient's monthly serum theophylline level measures 18 milligrams per ml. And E, the patient consistently follows the medication instructions given by their healthcare provider. The correct answer here is letter A. The PEFR, or the peak expiratory flow rate, is the best indicator of effective management of reactive airway disease because it will measure how quickly a person can exhale air, which is very important for assessing lung functions, especially in the case of asthma. And so when the peak expiratory flow rate is above 80% of the patient's best result, it signifies that the individual or the patient is maintaining good airflow and is less, or it will, this person is likely controlling their symptoms very well. And so this is a proactive measure that can show how well the treatment plan is working, and consistently achieving this target suggests effective asthma management. And so the other options here, B, C, D, and E, are all incorrect. B is incorrect because clear lung sounds alone do not confirm effective medication management. They do not measure the patient's overall control of symptoms. All right. If you selected letter C, it is also incorrect because experiencing 3 asthma exacerbations in 1 month indicates poor control of their condition rather than good management. So this finding actually would raise concern for the healthcare provider, prompting a reevaluation of the patient's treatment regimen. Now, if you selected letter D, look into the theophylline level, 18 milligrams per ml. And so although the theophylline typically ranges close to that normal range, it's in the therapeutic range, but this is only indicating that the dose is correct, but it does not reflect the effectiveness of the medication. Again, we're only looking into the drug level. It doesn't give us information about how the patient is actually doing. There's no indication if they are manifesting those signs and symptoms. Now, if you selected letter E, this is also incorrect. The patient consistently follows the medication instructions given by the healthcare provider. We know that adherence to the medication regimen is very important to manage their reactive airway disease, but it doesn't automatically equate to effective control of symptoms. Even if the patient takes their medications as prescribed, if those medications are not effective, or if the underlying condition is not well managed, the patient may still experience the symptoms. So it is very important for us to make sure The patient is taught to combine the medication compliance and also with effective symptom management. So to truly assess that the treatment is effective. Okay, so don't just focus into the compliance of the medication. You also need to assess the patient's bodily responses. Okay, moving on to our next item, 35. During morning medication administration, which medication should the nurse prioritize? A, the cardiac glycoside digoxin for a patient with heart failure and mild foot edema. B, the sliding scale insulin for a patient with a fasting blood glucose of 355 milligrams per DL who is requesting breakfast. C, the loop diuretic furosemide for a patient with a 24-hour intake of 990 mLs and an output of 1,500 mLs. D, the ARB for a patient with a blood pressure reading of 144/78 as reported by the unlicensed assistive personnel. In letter D, that's the angiotensin receptor blocker. So what is your answer here? It should be letter B. Administering the sliding scale insulin is very important because the patient is experiencing hyperglycemia. Take note about the blood sugar, 355. And while they're requesting breakfast, this is our priority option to prevent further complications. And so the other options, A, C, and D, are all incorrect because we know that digoxin is typically scheduled for administration at specific time, usually daily. And so this is less urgent compared to the insulin need in this case. Now, if you selected letter C, the loop diuretic is working as intended, and the administration is also scheduled to once a day, mostly in the morning. So this is not the immediate priority as well. And if you selected letter D, the blood pressure reading of 144/78, even though it's slightly elevated, it's not critically high enough to necessitate immediate medication administration. And so your strategy here is to be familiar with the common medications, their intended uses, and the principles of administration to make informed decisions about prioritizing the patient's needs. Let's have number 36. A nurse is administering morning medications to patients in the progressive care unit, PCU. Which medication should the nurse question? A, furosemide IVP for a patient whose potassium level is 3.7 milliequivalents per liter. B, digoxin orally for a patient with a rapid atrial fibrillation. C, morphine IV push for a patient who is sweating and experiencing chest pain. And D, enalapril orally for a patient with a blood pressure of 86/64 mmHg and an apical pulse of 68 beats per minute. You got to capture all these abnormal findings and prioritize them accordingly. So the correct answer here is letter D. Why? Look into the blood pressure of 86/64. Your patient is hypotensive. And when you're administering enalapril, which is an ACE inhibitor, this can lower the patient's blood pressure all the more. And this is an unsafe practice. So your task here is to withhold this medication and alert the healthcare provider. You got to notify them. If you selected other options like A, B, and C, these are all incorrect. We know that a potassium level of 3.7 in option A is within the normal range. And so this will allow you to safely administer the furosemide. But it should be monitored, as we know that Lasix or furosemide is a potassium waster. So you got to take a look into the laboratory studies after this medication is given. Now, letter B is also incorrect because this is appropriate for managing rapid atrial fibrillation. It will help to control the heart rate. And letter C, it is indicated for those patients with chest pain and also with the diaphoresis that it alleviates the pain, and it can also help improve the heart function. Now, your strategy here is to recall the normal lab values to eliminate unsafe options, and focusing on abnormal findings that require actions. Now let's have number 37. The nurse notes that a 34-year-old female patient with atrial fibrillation may have altered tissue perfusion. Which action should the nurse take? Select all that apply. A, monitor the patient's blood pressure and apical pulses every 4 hours. B, ask the patient to keep track of their intake and output each shift. C, have the patient sleep with the head of the bed elevated. And D, teach the patient Berger's Allen exercises every day. And E, confirm if the patient is taking any antiplatelet or anticoagulant medications. And F, assess the patient's neurological status every shift and as necessary. Your answer should be the following: letters A, B, E, and F. Why letter A? Monitoring the patient's blood pressure and apical pulse every 4 hours. Your patient here with atrial fibrillation will have expected irregular heartbeat, which can lower the cardiac output. And this can affect the blood pressure. It will cause the blood pressure to go lower as well. And so this is happening because when the atria aren't contracting effectively, this is going to compromise the blood flow. The cardiac output is also compromised. So your patient will not be receiving adequate perfusion to the vital organs in the body. So keeping track into the vital signs can help you identify any significant changes that could indicate worsening heart function or possibly the development of complications. Now, if you selected letter B, that is another correct answer. When the heart is not pumping effectively, it can lead to fluid retention and potential heart failure. So by doing the intake and output, you can catch early signs of fluid overload, allowing you to timely intervene and also to help you in adjusting the patient's fluid intake as prescribed. Now, if you selected letter E, this is another correct option, confirming if the patient is taking any antiplatelet or anticoagulant medications, because AFib can significantly increase the patient's risk of thromboembolism. Especially, it can complicate into strokes due to the formation of blood clots in the left atrium. We know that when there is incompetent, or let's say a decrease in the contractility of the ventricle, especially on the left side, this can cause stagnation of the blood, which will cause the clot formation. And so with this clot potentially being pumped into the circulation, this can potentially be sent into the cerebral circulation, which can cause stroke. And so it's very important for us to have letter E in the selection, because we know that anticoagulants such as warfarin or the other agents like the NOACs, the novel oral anticoagulants, including the apixaban, these are prescribed to reduce the risk of preventing clot formation. Now, if you selected letter F, assess the patient's neurological status every shift and as necessary. This is also very important because atrial fibrillation can lead to strokes, particularly if clots form, and this can travel to the brain. And so symptoms of stroke can include sudden confusion. It could be difficulty speaking, weakness on one side of the body. And so if we are routinely checking the patient's neuro status, we can detect these potentially life-threatening events very early. Now, if you selected letter C and D, these are incorrect options. For letter C, there's no specific evidence that requires the patient to sleep elevated due to AFib. Now, for letter D, these exercises are actually designed for patients with a peripheral artery disease, which will enhance the blood flow to the extremities by improving venous return and arterial circulation. However, these exercises do not apply to patients with AFib, which is going to have problems in the heart rhythm, okay? They're going to have problems with thromboembolic events, not about peripheral circulation. And so this is the end of part one. I will see you again for the part two NCLEX questions. So I hope that you're learning from this Q&A, and I'll see you again in the next video. Thank you. Our next item here is item number 38. When entering a client's room, the nurse finds the patient unconscious with no pulse or respirations. What should be the nurse's first action? A, notify the healthcare provider. B, call for a rapid response team. C, review the telemetry monitor reading. And D, activate the code blue alarm. The correct answer here is letter D. The first step is to alert the code blue team and initiate CPR as the patient shows clear signs of cardiac arrest. Now, if you selected letter A, B, and C, these are incorrect, because while informing the healthcare provider is necessary, it is not the immediate action in a life-threatening situation. If you selected letter B, this is also incorrect. The rapid response team is for cases of deterioration. This patient requires immediate resuscitation. And then also, if you select letter C, assessing telemetry is not needed before starting CPR in this critical scenario. So in emergencies, you have to prioritize immediate action over assessment if the situation is critical and clear. Number 39. A patient who recently had a myocardial infarction is 6 hours post right femoral percutaneous transluminal coronary angioplasty. Which assessment finding necessitates immediate nursing intervention? A, the patient keeps the affected leg straight. B, the pressure dressing on the right femoral area is secure. C, the patient reports numbness in the right foot. And D, the right pedal pulse is 3+. Your answer here should be letter C, because numbness in the foot following the femoral percutaneous transluminal coronary angioplasty could suggest compromised blood flow to the extremity. And this symptom might indicate vascular complications such as arterial occlusion, could be thrombosis, could be hematoma formation at the catheter insertion site, which could press on nearby vessels and nerves. And so if there is impaired blood supply, this can quickly lead to tissue ischemia. And so immediate nursing intervention here is essential. Now, if you selected letters A, B, and also letter D, these are incorrect options. If you select the letter A, the patient keeps the affected leg straight. Hang on a second. If you selected letter A, this is actually going to necessitate the proper alignment of the extremity. You got to make sure that the patient follows that restriction for at least 4 to 6 hours. And this is to minimize the risk of bleeding from the femoral artery insertion site. And so what is really the deal about the straightening of the leg or this duration? This actually will allow some time for the arterial puncture site to heal and also to seal properly. It will also reduce the risk of bleeding, or it will reduce the hematoma, or could be to reduce the dislodgement of the clot at the insertion site. Now, if in a case, if the scenario said something about the use of a closure device, such as an angio-seal or perclose, this will require the patient to keep their leg straight for only a short amount of time. So they could keep the leg straightened for about 1 to 2 hours. So that is an exception. Now, letter B. The pressure dressing on the right femoral area is secure. This is a positive indication of no active bleeding, so we're not going to worry about that. And letter D, the right pedal pulse is 3+. This indicates adequate circulation to the foot. There's no need for us to be concerned in this one. Now, we have to really identify those assessment findings that can indicate potential abnormalities, especially after this kind of procedure. Now let's have number 40. The nurse is getting a client ready for discharge after an esophagogastroduodenoscopy, or known as EGD. Which statement shows that the client understands the discharge instructions? Or did I skip something? The nurse is getting a client ready for discharge after an esophagogastroduodenoscopy for their gastroesophageal reflux disease, or GERD. Which statement shows that the client understands the discharge instructions? Is it A, I need to refrain from eating for at least 1 day after this procedure? B, I can lie down anytime after a meal. It doesn't matter. C, the contents of my stomach won't irritate my esophagus, but they will make me feel nauseous. And D, I should avoid orange juice and tomatoes until my esophagus has healed. The correct answer here is letter D. Avoiding acidic foods like orange juice, tomatoes is crucial for the client with GERD until the esophagus has had sufficient time to recover. Now, the other options, A, B, C, are incorrect because for A, clients can eat once their gag reflex has returned, so they do not need to wait a full day. And for letter B, since the GERD is still present, the client should remain upright for 2 to 3 hours after meals to prevent reflux. And letter C, the stomach contents are acidic and can cause irritation to the esophagus. So your strategy here is to understand the dietary restriction for clients with GERD, especially concerning acidic foods and their impact on the healing. Let's have number 41. A client receiving magnesium sulfate for severe preeclampsia has been on the medication for 10 hours. The nurse finds that the client's reflexes are absent and the respiratory rate is 10 brats per minute. Which factor might be causing these findings? A, heart rate of 106 beats per minute. B, urine output of 250 mLs over 12 hours. C, blood pressure of 166 over 122 mmHg. And D, temperature of 100 degrees Fahrenheit or 37.7 degrees Celsius. The correct answer here should be letter B. The low urine output is a significant factor, especially if the patient is taking magnesium sulfate IV, because magnesium is mainly excreted by the kidneys, and if there is insufficient output, it can lead to the accumulation of magnesium in the body, which can cause toxicity symptoms like what the patient is manifesting, basically. This can lead to the respiratory depression and the loss of reflexes. The other answers, A, C, and D, are incorrect. Letter A, heart rate of 106 beats per minute. It is not a cause for magnesium toxicity. If you select letter C, while it indicates preeclampsia, it does not explain magnesium toxicity. And letter D, this temperature is unlikely to result in the observed manifestations. So what you need to do here in this question is to identify magnesium toxicity signs and to recall that low urine output increases the risk due to the decreased elimination of the drug. Let's have number 42. A client with ulcerative colitis is advised to follow a low-residue diet. Which meal choice shows that the client understands the dietary guidance? A, grilled hamburger on a whole wheat bun with fried potatoes. B, chicken salad sandwich along with a salad of lettuce and tomatoes. And C, roast pork with white rice and plain custard. And D, fried fish, whole grain pasta, and a fruit salad. Your answer here should be letter C, because this is a low residue diet. There is a need for us to limit fiber. So those foods like finely milled grains and well-cooked meats rather are appropriate for this test item. Now, if you selected letters A, B, and D, these are all incorrect because fried potatoes in letter A should be avoided, as should pastries and also pies. Now, if you selected letter B, raw vegetables are considered roughage and should be avoided on a low residue diet. And fried foods and whole grains are high in fiber and should be eliminated from this diet. So you got to familiarize with the therapeutic diets, particularly low residue, which is synonymous with low fiber. Let's have question number 483. The home health nurse is assigned to an adult male patient with heart failure. What action should the nurse perform? Select all that apply. A, arrange for a dietary consultation for a sodium-restricted diet. B, advise the patient to elevate their feet throughout the day. And C, teach the patient to weigh themselves every morning in the same attire. And D, check for swelling in the lower body areas. E, suggest that the patient consume at least 3,000 mL of fluid daily. And F, have the patient repeat the instructions given to them. The correct answers are letters A, B, C, D, and F. Why letter A? The dietitian can help explain the sodium restrictions to the patient and also identify hidden sources of sodium in the diet. B is also correct because elevating the feet can reduce the swelling by facilitating the return of excess fluid to the heart for elimination by the kidneys. C is also correct because patients should weigh themselves each morning in consistent clothing to monitor for any significant weight changes, which could indicate fluid retention. Now, letter D is part of the correct answers because assessing for edema is essential because it can reveal fluid accumulation, particularly in areas affected by gravity. And letter F, ensuring that the patient understands the instructions by having them repeat them back is a good practice for effective communication and patient safety. Letter E is incorrect because while hydration is important, the 3,000 mLs is excessive for a patient with heart failure. It will lead to fluid overload. Let's have number 44. A 56-year-old female patient with a terminal cancer is experiencing severe pain. What is the most crucial information for the hospice nurse to convey to the patient and their family? A, if the pain medications aren't effective, the patient should distract themselves. B, pain medications should be taken at the first sign of pain before it escalates. C, family and friends should not visit when the patient is in pain. And D, taking too much narcotic medication will lead to addiction. The correct answer here is letter B. The nurse should instruct the patient to take pain medications soon as they feel discomfort because delaying medication can make managing pain more challenging. The other answers, A, C, D, are incorrect. So for letter A, patients should be encouraged to inform hospice staff if they are not achieving adequate pain relief. Same thing with letter C. This would unnecessarily isolate the patient. Visitors can actually provide comfort, and those who become drowsy from medications should simply sit quietly with the patient. Now, for D, in the context of terminal illness, concerns about addiction are not applicable. The focus should be on effective pain management. Next item, number 45. A nurse is preparing to administer a bolus dose of medication through an active IV infusion. What is the nurse's initial action? A, pinch the tubing above the infusion port while administering the bolus. B, confirm compatibility with the IV solution currently in use. C, use a volume control infusion set with micro drip tubing. And D, administer it into a 50 ml bag of normal saline via a secondary line. The correct answer here is letter B. Before administering any medication, it is important to ensure that it is compatible with the existing IV solution because it can possibly alter the medication's effects or create harmful compounds. Now, the other options, A, C, and D, are all incorrect. Letter A, pinching the tubing should occur immediately before and during the administration of the bolus to ensure proper flow, not as the first step. If you select the letter C, this is also incorrect. A volume control infusion set is not needed for a bolus dose, which involves a smaller volume fluid. And letter D, administering a bolus dose into a 50 ml bag is not appropriate, as that is typically reserved for intermittent infusions over a longer period. Let's have number 46. A nurse is about to start a nitroglycerin infusion for a 49-year-old male patient in cardiogenic shock. The patient has TPN running through a triple lumen catheter. What should the nurse do? A, dilute the nitroglycerin in 500 ml of lactated Ringer solution. B, administer the nitroglycerin through its own line. C, use standard IV tubing for the nitroglycerin administration. And D, make sure the nitroglycerin patch is placed on hairless skin. The correct answer here is letter B. The nitroglycerin needs its own dedicated line to avoid interactions, especially with the TPN, which could cause incompatibilities and also affect the accurate dosing. And so this intended separation can ensure the safe and effective delivery of nitroglycerin, which is very important for its vasodilating effect in managing the cardiogenic shock. And it will also allow precise control of the infusion rate. So if you selected other options such as letter A, C, and D, these are all incorrect, because with letter A, nitroglycerin, the lactated Ringer solution, it contains calcium, which can interact with certain medications, and it may cause chemical instability as well, and especially with nitroglycerin. So the nitroglycerin is usually diluted in D5, water, or 5% dextrose in water, or normal saline, which are more stable and compatible with the drug. Now, letter C, standard tubing, is incorrect. What we should be doing here is to select a different kind of tubing, because the standard IV tubing tends to absorb the nitroglycerin due to the drug's fat attracting property, or known as lipophilic property. So this can possibly cause significant portion of the dose to be lost before it reaches to the patient. And D is incorrect, because when a patient is receiving nitroglycerin IV, any nitroglycerin patches should be removed to avoid an overdose. And we know that the nitroglycerin patches also provide a continuous dose of the medication. So using both a patch and an IV infusion can cause dangerously low blood pressures, and it can lead to excessive vasodilation. So here your task is to really understand the compatibility and the administration requirements of medications, especially those requiring special handling. Now let's have a number 47. A 25-year-old female client has gone into cardiac arrest due to an overdose of tricyclic antidepressants. Their arterial blood gases show the following results: pH 7.31, partial pressure of O2 60, partial pressure of carbon dioxide 58, and bicarbonate level is 19. What medication should the nurse prepare to administer? Pay attention to the numbers. Your answer here should be letter B. That is sodium bicarbonate, because the ABG values indicate that the client is in metabolic acidosis. The sodium bicarbonate is the preferred treatment to correct the acidosis in this case, particularly for cardiac arrest resulting from tricyclic antidepressant overdose. Now, if you selected the other options, A, C, or D, these are incorrect. The adenosine is an antiarrhythmic medication, but it's not indicated for metabolic acidosis or tricyclic overdose. This is a drug that is primarily used to treat supraventricular tachycardia. If you select letter C, this is also incorrect. Calcium gluconate is typically administered to address a low calcium level or hypoglycemia. It's not to treat metabolic acidosis resulting from tricyclic overdose. Now, if you select letter D, this is also incorrect. We know that dopamine can be used in various shock states, but it does not address the underlying metabolic acidosis in this case. Let's have number 48. Following the third round of chemotherapy, a 28-year-old client with cancer develops diarrhea. What action should the nurse take? A. Recommend the client take up to 12 loperamide 2 milligram tablets each day. B. Put the client on a clear liquid diet. C. Administer promethazine suppositories to the client. And D. Discuss adding fiber supplements to the client's diet. Your answer here should be letter D. Adding fiber supplements can help firm up the patient's stools for client experiencing diarrhea, particularly with chemotherapy-induced diarrhea. So what we're actually talking here is that the soluble fiber, this is a specific type of fiber. Soluble fiber can absorb excess fluid in the intestines. It can improve stool consistency, and it will reduce the frequency of diarrhea. Take note, I'm talking about soluble fiber. Now, if you selected the other options, A, B, and C, these are incorrect options because taking more than the recommended 16 milligrams per day of loperamide isn't safe. And B, a clear liquid diet lacks the bulk needed to solidify the stools, and it can lead to malnutrition. And letter C, promethazine is an antiemetic, not effective in treating diarrhea. And rectal administration is likely ineffective. Let's have number 49. While preparing medications for the morning medications, on the medical surgical unit, which medication should the nurse question? A. Vitamin B12 for a client with pernicious anemia. B. Erythropoietin for a client with chronic lymphocytic leukemia. C. Filgrastim for a client with a solid tumor. Or D. Heparin intravenously for a client with disseminated intravascular coagulation. Your answer here should be letter B. Erythropoietin can stimulate the red blood cell production, which is inappropriate with it's going to be inappropriate for those clients with chronic lymphocytic leukemia if the disease involves the bone marrow. The other options, A, C, and D, are incorrect because vitamin B12 is essential for treating the pernicious anemia, so administering that med is appropriate. Letter C, the filgrastim, it can promote the white blood cell production, and this is necessary for clients with solid tumors. Now, if you select the letter D, heparin is commonly used in treating DIC, so it is indicated for that condition. So let's go right into our next test item, number 50. A nurse observes irritated skin around the colostomy stoma of a patient with colon cancer. What should the nurse do first? A, request a consultation with a wound ostomy continence nurse. B, apply a protective skin barrier paste around the stoma. C, gently clean the area with mild soap and water. And D, replace the pouch with one that is 1/3 inch larger than the stoma. Your answer here should be to select, that's letter C. Before applying any skin barrier paste, the nurse should clean the skin gently because we know that mild soap can help remove any fecal matter and also the old barrier paste. And this will make the skin ready for protection. So if you selected the other options, A, B, and D, these are incorrect. For A, while consulting with a specialist is important, Immediate action is required to protect the skin. Now, for letter B, the skin should be cleaned first to ensure the paste adheres properly and protects against further irritation. If you selected letter D, the pouch should only be changed after the skin has been cleaned and properly protected. Let's have number 51. A 28-year-old woman with chronic reactive airway disease is prescribed Montelukast sodium. Which statement from her indicates that the education she received was effective? A, I will avoid coffee, tea, and any soda. B, I will take this medication when an asthma attack starts. C, it's fine to take this medication if I want to become pregnant. D, I should not reduce the dosage or stop this medication abruptly. The correct answer here is letter D. Patients should not discontinue Montelukast suddenly or to adjust the dosage without consulting the healthcare provider. This statement alone reflects a proper understanding of the medication use. So the other options, A, B, and C, are all incorrect. So for A, Montelukast does not have central nervous system stimulatory effects, so avoiding caffeine is unnecessary and it reflects a misunderstanding of the medication's effects. If you select letter B, this is also incorrect because Montelukast is not intended for treating acute attacks. It is used to prevent the attacks. Now, if you select letter C, it is also incorrect because the safety of Montelukast during pregnancy has not been fully established. So this statement demonstrates a lack of understanding regarding its use in such situations. Let's have our next item, number 52. The nurse gives diphenhydramine Benadryl to a client post-cesarean section who is experiencing side effects from IV morphine. What precaution should the nurse take after administering Benadryl? A, place the client in a semi-upright position on her left side. B, stay with the client while she holds her baby. C, ask all visitors to leave the room. And D, check the client's urine output every hour. The answer here is letter B, because Benadryl and morphine can both cause sedation, which it can increase the risk of the clients falling asleep while holding the infant. So supervising can ensure the safety of both the mother and the baby this time. So the other options here, letters A, C, and D, are incorrect. So for A, there is no need for a specific position post Benadryl unless otherwise indicated. And for letter C, there's no need to limit visitors purely because of Benadryl administration. And letter D, hourly urinary output monitoring is unnecessary solely due to the Benadryl use. So your strategy here is to focus on the potential side effects or sedative effects rather of both medications and make sure that you prioritize safety precautions related to holding the infant. Our next item, number 53. A 52-year-old male client with chronic kidney disease has been prescribed erythropoietin. Which actions should the nurse take? Select all that apply. A, administer it through intramuscular injection in the deltoid muscle. B, provide acetaminophen for any discomfort. C, monitor the client's complete blood count. D, educate the client about pacing their activities. And D, advise the client against driving for 90 days. Your answer should be letters B, C, D, and E. With B, erythropoietin can cause bone pain, which can be alleviated with acetaminophen or Tylenol. If you select letter C, that's also one of the correct answers because monitoring the CBC is very important because we know that the erythropoietin can stimulate the red blood cell production. Now for D, it's also one of the correct answers because clients with the anemia should pace activities in order to manage their fatigue effectively. And letter E, rapid increases in the hematocrit can lead to seizures. So you've got to be careful. Clients here should avoid driving and to avoid operating heavy machinery for 90 days until they know how their body is able to handle it. Okay. If you selected letter A, this is incorrect because erythropoietin is administered subcutaneously, not IM. Let's have number 54. A male patient with prostate cancer is receiving leuprolide implant. What is the correct method for administering this medication? A. Use a tuberculin syringe to inject it subcutaneously. B. Insert a 16-gauge needle at a 30-degree angle into the abdomen. C. Place the medication in the rectal cavity using a non-sterile glove. And D. Administer it with an antacid to prevent peptic ulcer disease. Your answer here should be letter B, because this is a medication, the leuprolide, or known as the Lupron, is a gonadotropin releasing hormone agonist. And it comes as an implant that gradually dissolves over a month. And the medication is formulated as a pellet, and this is administered using a 16-gauge needle subcutaneously in the abdomen. So the other options, A, C, and D, are incorrect. So for letter A, leuprolide is not given with a tuberculin syringe. It requires a 16-gauge needle for administration. Now, if you selected letter C, this is also incorrect because leuprolide is not meant for rectal administration. It is delivered as an implant. And letter D is also incorrect because this medication does not cause peptic ulcer disease and is not given orally. Number 55. A patient has an implanted port placed for chemotherapy. When the nurse tries to access the port, there is no blood return, and there is a resistance when flushing. What should the nurse do to access the port? A. Forcefully inject 3 mL of heparin into the port. B. Flush the port with 5 to 10 mL of normal saline. C. Administer a prescribed amount of urokinase into the port. And D. Arrange for a new implant port to be placed. Your answer here should be letter C. Urokinase is a thrombolytic agent. It is a clot buster. And administering a small volume into the port and also allowing it to sit and dwell, I should say, it can help dissolve any clot present in the catheter, and this may need to be repeated several times to clear the blockage. The other options, A, B, and D, are incorrect. And for A, forcing any substance into the port can push a clot into the patient's system. And heparin is an anticoagulant and will not dissolve clots. Okay, it is not a clot buster. If you selected letter B, this is also incorrect because flushing may push a clot into the bloodstream. It can lead to serious complications like stroke or pulmonary embolism. And letter D, only the healthcare provider can decide if a new port is necessary, and they'll schedule the procedure accordingly. Now, your task here is to familiarize with the medication classifications. Remember that the anticoagulants prevent clot formation, but they do not dissolve existing clots. Only the thrombolytics like TPA or tissue plasminogen activator or urokinase can do the lysing, dissolving of the clot. And take note of the keywords here, especially the ACE in the urokinase. It indicates an enzyme. It suggests thrombolytic properties. So that is a clue there. Let's have number 56. An 18-month-old girl has ingested her grandparents' prescription of digoxin and syrup of ipecac has been administered. What is the most crucial action for the nurse to take? A. Inform the parent to expect vomiting in about 20 minutes. B. Have the patient or have the child placed on telemetry to monitor cardiac status. C. Ask the unlicensed assistive personnel to monitor vital signs. And D. Order a stat digoxin level to be drawn. Your answer here should be letter A. Syrup of ipecac induces vomiting, and the nurse should prepare the parent for this response to the medication. This is going to help remove the digoxin from the stomach. Now, if you selected letter B, C, and D, these are incorrect options. While we know that monitoring the patient's heart rhythm is important, but the immediate concern is preparing the parent for the expected vomiting, which is more critical at this moment. Now, if you select the letter C, the nurse cannot delegate care for an unstable child to an unlicensed personnel due to the potential risks involved. And letter D is also incorrect. There is no immediate need for this, as the goal is to remove the digoxin from the system before it can significantly impact the heart. So you need to prioritize child safety in this scenario. Always focus on interventions that directly impact the patient's safety and well-being, particularly in emergency situations. Let's have number 57. A nurse is preparing to give pegfilgrastim. Which actions should the nurse take during the administration of this medication? Select all that apply. A. Utilize a 1 ml 5/8 inch syringe and inject it into the deltoid muscle. B. Combine the powder with sterile normal saline and administer it within 1 hour. And C. Check the patient's blood pressure and pulse before giving the medication. And D. Withhold the medication for 24 hours before or after chemotherapy. And letter E. Keep track of the patient's white blood cell count and absolute neutrophil count. Your answer here should be letter A. D and letter E. Why letter A? Because pegfilgrastim, or known as Neulasta, is a hematopoietic growth factor, which is going to help produce the white blood cells over an extended time. And this is a medication that is administered subcutaneously with 1 ml, 5/8 of an inch needle. And the deltoid muscle is the acceptable site for this injection. Now for letter D, since the pegfilgrastim can stimulate the blood cell production, it should not be given within 24 hours of chemotherapy, which reduces white blood cell count. So take note about this. And letter E is also a correct answer. Monitoring the white blood cells and absolute neutrophil count can help assess the effectiveness of Neulasta or the pegfilgrastim. The other options, such as B and C, are incorrect. B, the medication is available in a 10 milligram per ml vial, and it does not require mixing with saline for administration. And if it is used for an IV infusion, D5 water is appropriate. Now for letter C, check the patient's blood pressure and pulse before giving the medication. Patients that receive red blood cells, stimulants like Epogen or Procrit do not need vital signs check unless specifically indicated for that treatment. Let's have number 58. After a 28-year-old male client has been successfully resuscitated, their arterial blood gases are as follows: pH of 7.35, partial pressure of O2 78, partial pressure of carbon dioxide 46, and bicarbonate is 22. What action should the nurse take? A. Assess the client's pulse oximeter reading. B. Prepare to give sodium bicarbonate IV push. C. Provide oxygen at 8 liters per minute via nasal cannula. And D, take no action as the ABGs are within normal limits. Your answer here should be letter C. The partial pressure of this patient of 78 is below normal. It should be within 80 to 100 mmHg. And this indicates the need for supplemental oxygen to ensure adequate oxygenation. That's why the correct answer here is letter C. Provide O2 at 8 liters per minute via nasal cannula, high flow nasal cannula, not the regular simple ones. And if you selected options letter A, B, and D, these are incorrect. For letter A, assess the client's pulse oximeter reading. We know that pulse oximetry is a helpful tool for continuous monitoring, but we already have more precise arterial blood gas data, which is already shown in the ABG. So we know that pulse oximetry reading might confirm low O2 saturation, but it won't provide any additional actionable information beyond what the ABG already shows. And we know that the arterial blood gas is this gold standard. So the nurse should focus on addressing the documented hypoxemia directly by providing the oxygen. Now, if you selected letter B, this is incorrect. The ABGs do not suggest metabolic acidosis. So sodium bicarbonate is not indicated. And for letter D, taking no action as the ABGs are within normal limits, it's totally incorrect. Noting into the abnormal values already. While the pH, the partial pressure of carbon dioxide and the bicarbonate are within the normal limits, but the partial pressure of the O2 is low. It indicates hypoxemia. So if you're ignoring this finding, this could leave the patient at risk for inadequate oxygen delivery to the tissues, which is really concerning after they're resuscitated. Okay, so you gotta act on this one, provide oxygen supplementation as necessary. Let's have number 59. A 60-year-old woman has been on hormone replacement therapy, HRT, for managing menopausal symptoms for the past 9 years. Which statement by the nurse indicates the client's risk of developing breast cancer? A, the risk of developing cancer decreases each year that a client takes hormones. B, the risk is similar to that of women who do not use HRT. And C, the risk increases each year the client remains on HRT. And letter D, the risk is only slightly elevated while taking HRT. Your answer here should be letter C. The risk of breast cancer goes up each year a client is on the hormonal replacement therapy. And the current studies have also linked HRT to an increased risk of cardiovascular disease. The rest of the options, letter A, B, and D, are incorrect. For A, this statement is inaccurate. The risk actually increases with longer use of hormones. For B, this statement is false. Evidence shows that women on HRT have a higher risk of developing breast cancer. And letter D, this statement is misleading as well. The risk significantly increases with prolonged use of HRT. Let's have number 60. Following successful resuscitation, a 32-year-old male client has converted from ventricular fibrillation to a sinus rhythm with premature ventricular contractions. The healthcare provider orders a dopamine infusion at 3 milligrams per kilo per hour. What intervention should the nurse implement for this medication? Select all that apply. A, check the client's urine output every hour. B, monitor the client's blood pressure every 15 minutes. C, evaluate the client's glucometer readings every 4 hours. D, assess the client's telemetry readings every hour. E, obtain laboratory dopamine levels daily. Your answers should be letters A and B. Okay? Monitoring the urine output is critical because this reflects the effectiveness of dopamine in improving renal perfusion and also the blood pressure. So the goal here is to achieve at least 30 mLs per hour urine output. Now for letter B, we know that dopamine is a vasopressor that affects blood pressure, so it must be monitored closely to assess the response to the treatment. The rest of the answers, C, D, and letter E, are incorrect. Now for letter C, checking the patient's blood glucose is not relevant to assessing the effectiveness of dopamine therapy. It does not indicate complications. If you selected letter D, telemetry is important, but it's not specific to evaluating the effectiveness of the dopamine or the potential complications related to its use. We know that dopamine has an impact into the hemodynamic parameters such as the blood pressure and urine output. So letter D is unnecessary. Now, if you selected letter E, there is no specific lab test to monitor the therapeutic level of dopamine, so its effects are gauged through clinical assessment, blood pressures, and the urinary output to be checked. We'll have item number 61. A breastfeeding client who is not immune to rubella has just received the rubella vaccine. What possible side effect should the nurse mention? A, the baby may temporarily refuse to breastfeed. B, the mother may experience joint pain and stiffness. C, the baby may develop a skin rash. And D, the mother's milk supply could decrease suddenly. Your answer here should be letter B, because about 25% of women report joint discomfort after they receive the rubella vaccine. This reaction is temporary and does not affect the baby. The other options, A, C, and D, are incorrect. For letter A, there's no evidence suggesting that the vaccine affects the baby's feeding behavior. For letter C, the mother may develop mild rash but does not affect the baby as well. And letter D, the vaccine does not impact lactation volume. So you gotta know the common post-vaccine reactions and provide reassurance about non-effects on breastfeeding infants. Let's have number 62. A mother expresses concern that her newborn's face appears purple after a rapid labor. On assessment, the nurse observes petechiae on the baby's scalp and face. Which of the following should guide the nurse's response? A, petechiae are a normal newborn rash. B, petechiae suggests a bacterial infection. C, a quick labor can cause localized bruising on the presenting part. And letter D, the petechiae indicate potential child abuse. The correct answer here is letter C. This can result from pressure during the rapid deliveries, especially on the presenting part of the newborn. So there are other answers, letter A, B, and D, are incorrect. A, petechiae are distinct from newborn rash, which is usually erythema toxicum. If you selected letter B, petechiae can indicate infection, but there is no evidence of infection in this case. And letter D, no signs of abuse are present. Trauma likely occurred during delivery. So your strategy here is to focus on the details of delivery speed, which suggests a trauma-related cause rather than infection or other conditions. Number 63. A nurse is providing pre-op instructions 1 week prior to an adult male client surgery. The client has been taking 650 milligrams of aspirin twice daily for arthritis. What guidance should the nurse include regarding their aspirin use? A, continue taking the aspirin without changes. B, discontinue aspirin 5 days before surgery. C, skip the aspirin dose on the morning of the surgery. And letter D, lower the aspirin dosage to 81 milligrams daily until after surgery. Your answer here should be letter B, because aspirin is a salicylate which can inhibit thromboxane, which is crucial for platelet aggregation. And the half-life of 15 to 30 hours. So it should be stopped at least 5 days before surgery to minimize the risk of bleeding. I'm talking about a delay in the removal of the medication from the body. The half-life of 15 to 30 hours is actually long. So that is our correct answer. If you selected the other options A, C, and D, those are incorrect. For letter A, continuing aspirin usage is dangerous as it may prevent platelet aggregation. It will increase the risk of hemorrhage during surgery. And letter C is also incorrect. It is not safe to take aspirin up to the morning of surgery since its effects can still be present, potentially leading to increased bleeding. And letter D, lowering the aspirin dosage to 81 milligrams does not eliminate its effect on platelet aggregation and can still pose a risk for bleeding. So your strategy here is to focus on understanding the pharmacodynamics of medications and their implications for surgical procedures. Now, you got to remember those medications affecting clotting and platelet functions, and these must be carefully managed before surgery. Let's have number 64. A 27-year-old female patient is receiving negative pressure wound therapy after toe amputation. What should the nurse do if the film over the wound collapses when negative pressure is applied? A, inform the primary healthcare provider about the situation. B, decrease the level of negative pressure. C, place a new transparent film over the wound. And D, continue to monitor how the device operates. Your answer here should be letter D. The collapse of the transparent film indicates that the device is functioning properly. This is a normal reaction when a negative pressure is applied, showing there are no leaks. The other options, A, B, C, are all incorrect. For letter A, there's no need to notify the healthcare provider, as this is an expected occurrence during the treatment. Now, if you selected letter B, if you're altering the negative pressure settings, this is unnecessary. And this also requires a physician's order. The pressure settings must remain within the prescribed limits. If you selected letter C, this is also incorrect. There is no need to replace the transparent film since the device is intact and also functioning as intended. So you need to understand the principles of the specialized therapies such as negative pressure wound vac or wound therapy, and also to recognize the normal versus abnormal equipment function. Let's have number 65. A nurse needs to help an adult male patient put on a hospital gown without shoulder snaps while the patient has an IV infusion in their forearm. What is the best approach? A, dress the arm with the IV first, draping the gown over the opposite shoulder and secure it behind the neck. B, temporarily clamp the IV tubing for a maximum of 15 seconds while dressing the patient. C, disconnect the IV at the site, put on the gown, and then reconnect the IV. And D, insert the IV bag and tubing through the gown sleeve from the inside first. Your answer here should be letter D. By inserting the IV bag and tubing through the sleeve from the inside first, this will ensure that the IV remains secure, and it also reduces the risk of dislodging the catheter. Now, if you selected letter A, Draping the gown in this manner can expose the patient unnecessarily. This can compromise their privacy and also their comfort. If you selected letter B, clamping the IV line may lead to complications such as clotting at the catheter tip, which can hinder fluid delivery. And letter C, disconnecting the IV can increase the risk of infection and is unnecessary. Unnecessary. So the gown can be adjusted without disconnecting. Okay? So your strategy here is to always consider patient safety and comfort when managing IVs and other medical devices during care activities. Let's have number 66. A nurse assesses a client who suffered injuries from a car accident. The client does not open their eyes in response to questions, but reacts to painful stimuli and makes sounds without forming words. Using the Glasgow Coma Scale, what score should the nurse record for the client's level of consciousness? A, 4, B, 6, C, 8, D, 10. Your answer here should be letter C, which indicates severe brain injury. Anything that is in the level of 8 or less than that, it typically indicates coma. It's severe head injury. So the score of an 8 on the Glasgow Coma Scale corresponds to the client's, if you're, yeah, to the client's observed responses, such as outlined in the scale criteria, right? Now, what are we going to do here? Especially if our scale or if the score is 8. Your patient is at risk in their airway. So you got to monitor this patient continuously, especially with vital signs, their neuro status and oxygenation. And you need to ensure that the patient's airway is open and maintained, because when their GCS is around 8 or less than that, their gag reflex will be absent, their cough reflex will be absent as well, and the same thing with the swallowing reflexes. And we know that these reflexes are very important to protect the airway from aspiration, which can occur when the saliva or vomit accidentally inhaled into the lungs. So this can increase the risk of aspiration pneumonia. And also, the reduced level of consciousness can affect the brainstem centers, which are responsible for breathing. And this can also lead to the hypoventilation or insufficient breathing, and this can complicate into hypoxemia as well. And furthermore, it can worsen the brain injury and compromise other organs of the body. So other stuff that you should be doing in this case scenario, you want to make sure that you are going to be prompt in arranging for any imaging studies that might be ordered by the medical provider to assess the extent of brain injury. You're going to notify the provider, promptly inform the patients, inform them about the patient's score and any changes in the condition. And you also need to prepare for a possible ICU admission because of the low GCS. This patient will require ICU monitoring and possibly mechanical ventilation if their condition worsens. Alrighty, let's have number 67. When preparing a parenteral medication, under what circumstances should a nurse use a filtered needle? A, needs to be mixed with another medication. B, comes in an ampule. C, is cloudy in the vial. D, requires reconstitution. Your answer here should be letter B. Using a filtered needle is very important when drawing medication from an ampule to prevent the glass fragments from entering the syringe. Now, the other answers, A, C, D, are incorrect. For letter A, using a filtered needle is unnecessary for mixing medication. If you selected letter C, cloudiness in a vial usually requires further evaluation, but does not necessitate the use of a filtered needle. And for letter D, requires reconstitution. This typically occurs in closed vials, not requiring a filtered needle. Let's have number 68. A home care nurse observes a client's spouse administering a rectal suppository. What action indicates the need for further teaching on this procedure? A. The spouse lubricates the suppository tip. B. The spouse wears gloves during administration. C. The spouse inserts the suppository while the client bears down. And D. The spouse places the suppository a finger's length into the rectum. Your answer here should be letter C, because bearing down during insertion can increase the abdominal pressure, and this can hinder proper placement of the suppository. So what you're going to do to your client this time is to instruct them to relax and breathe normally during the administration. The other options, A, B, and D, are incorrect. Letter A actually reflects that the spouse understood the correct procedure, because lubrication is important to minimize the discomfort and facilitate the insertion. The same thing with letter B. This action reflects understanding on how to properly administer the medication. It's a standard precaution to prevent contamination. And letter D, inserting a suppository approximately 4 inches ensures it passes the internal sphincter in the adults. All right, so it should be a finger's length into the rectum. Let's have number 69. A 27-year-old female client in the intensive care unit suddenly goes into asystole on the monitor. Which actions should the nurse take? Select all that apply. A. Determine if the client has a do not resuscitate order or DNR order. B. Prepare for a synchronized cardioversion. C. Prepare to give epinephrine IV push. D. Start cardiopulmonary resuscitation CPR. And E. Prepare to defibrillate the client at 300 joules. Your answer should be the following: letters A, C, and D. You got to determine if the client has a DNR order. It is very important to confirm whether the client has this status in order for you to guide the team in doing the resuscitation efforts appropriately. If you selected letter C, prepare to give epinephrine IV push. This is the first line medication for asystole, and this also helps increase the cardiac perfusion and will promote electrical activity in the heart. If you selected letter D, start CPR is critical in asystole in order to maintain blood flow and also oxygenation to the vital organs. If you selected letters B and E, these are incorrect, because we know that B, this intervention is inappropriate in asystole. This is used, the cardioversion is used for certain arrhythmias with electrical activity, not for absent heart activity. If you selected letter E, this is also incorrect. Defibrillation is ineffective in asystole because there is no electrical activity to restore. All right. Let's have our next item, number 70. During the initial 15 minutes of a blood transfusion, a 41-year-old male patient reports shortness of breath, lower back pain, and widespread itching. What actions should the nurse take? Select all of that apply. A. Administer 0.5 mL of epinephrine IV. B. Check the patient's temperature, pulse, and blood pressure. C. Infuse normal saline at 125 mL per hour through a peripheral IV. And D. Stop the blood at the IV catheter hub. And E. Inform the healthcare provider about the patient's condition. The correct answers here are letters A, B, C, D, and E. For A, We know that the patient's symptoms indicate anaphylactic reaction, and so epinephrine is the first line treatment. For B, the monitoring of the vital signs is very important to assess the severity of the reaction. And for letter C, we got to maintain that IV access with saline to facilitate medication administration and to manage shock. And to select letter D, stopping the transfusion immediately at the hub is very important to prevent further exposure to the allergen. And letter E, inform the healthcare provider is very important for further management of the anaphylactic reaction. So always recognize and also act on the signs of acute adverse reactions during transfusions promptly. Let's have number 71. A nurse instructs a 20-year-old client to take deep breaths and hold each breath for a second while using a handheld nebulizer. When the client inquires about the reason for this technique, how should the nurse respond? A, it makes the treatment last longer. B, it helps to avoid hyperventilation. And C, it ensures the medication is evenly dispersed. D, it stops bronchial spasms. Your answer here should be letter C. Holding the breath after inhalation can allow for better distribution and also the absorption of the medication before exhaling. The other options A, B, D are incorrect. For letter A, there's no benefit to prolonging the treatment duration. For B, while we know that deep and slow breaths can help manage the hyperventilation, but that is not the main purpose of holding the breath. Now for letter D, to prevent bronchial spasms, controlled breathing is more effective than simply holding the breath. Let's have number 72. A home care nurse is assigned to care for an elderly client living independently. What initial action should the nurse take to minimize the risk for falls for this client? A, recommend that the client eliminate throw rugs from their living space. B, suggest improving lighting in all areas of the home. C, conduct a thorough assessment of fall risks. And D, talk with the client about common aging changes that could lead to falls. Your answer here should be letter C. Assessing fall risk is the foundational step in the nursing process, especially in this case. And you got to identify those potential hazards, allows to implement those various strategies to effectively prevent this client from falling. So the other options, letter A, B, and D, are all incorrect. We know that even though if removing the throw rugs is helpful, it is only one of many strategies and not comprehensive on its own. If you selected letter B, ensuring good lighting is important, but it should not be the only action taken to prevent falls. And for letter D, discussing aging issues is beneficial, but it does not directly address the immediate need for fall risk assessment. Now let's have number 73. A nurse is caring for a 34-year-old male patient with a nasogastric tube for gastric decompression. What nursing action is most important? A, stop the wall suction during nursing care. B, position the patient in a semi-Fowler's position. C, instill 30 mLs of air into the tube every 2 hours. And D, care for the nares at least every 8 hours. Your answer here should be letter B. Positioning the patient in the semi-Fowler's position can help prevent reflux and also prevent the aspiration by using gravity to keep the gastric contents in the stomach while allowing for effective drainage. The rest of the options, A, C, and D, are incorrect. If you select A, stopping the wall suction is unnecessary and could lead to complications like vomiting and aspiration. If you selected letter C, routine air installation is not typically performed every 2 hours and should only be done if the tube is clogged. Letter D, nasal care should be done more frequently than every 8 hours to avoid irritation and discomfort. So your strategy here is to emphasize the importance of patient positioning and safety in nursing care, especially with devices that can manage the gastrointestinal function. Number 74, we're almost there. A nurse is assessing the success of interventions to meet an adult female client's nutritional needs during the first 48 hours after abdominal surgery. Which outcome is the most critical? A, there have been no episodes of nausea and vomiting. B, fluid and electrolyte levels are stabilized. C, healing of the wound is advancing well. And D, the client has resumed oral intake. Your answer should be letter B. We need to make sure that there is maintenance of fluid and electrolytes in order to stabilize the body and also will aid in the recovery, including the metabolism and also the nerve activity. So if you selected the other options like A, C, and D, these are incorrect. Letter A, preventing the nausea and vomiting may not be realistic post-surgery, and essential nutrients can still be absorbed even with these symptoms. If you selected letter C, wound healing evaluation is often difficult during the initial inflammatory phase, which can last several days. And for letter D, oral intake should only resume once intestinal motility has returned, which can take several days after surgery. Now, what is your strategy here? You got to prioritize physiological needs in client care. So, fluid balance is fundamental to recovery, particularly after the surgical procedure. Item number 75, finally, a 33-year-old male patient has been diagnosed with acute radiation syndrome, ARS. What signs should the nurse look for during the acute phase? A, high blood pressure and slow heart rate. B, fluid and electrolyte imbalance along with a shock. C, low levels of lymphocytes, leukocytes, and erythrocytes. D, symptoms such as nausea, vomiting, diarrhea, and fatigue. Your answer here should be letter D, delta. In the acute phase of ARS, the manifestations are the following. There's going to be nausea, vomiting, diarrhea, and fatigue, which can manifest within 48 to 72 hours post-exposure. If you selected letters A, B, and C, those are incorrect. A, elevated blood pressure and bradycardia can occur in the later stage of the radiation sickness. So this is associated with poor prognosis. If you selected letter B, fluid and electrolyte imbalances can typically develop in the illness phase, occurring after several weeks following the exposure. And if you selected letter C, low levels of the lymphocytes, leukocytes, this can occur during the latent phase, which can last several weeks after the initial exposure. So there are situations that actually can lead to the ARS, especially in the acute care setting. So one of those would be the radiation therapy errors, possibly the miscalculation in the radiation dose during a cancer treatment due to maybe equipment malfunction or maybe human error, or could be as a result to radiation contamination, could be exposure to the radioactive materials from spills, or let's say improper handling during the diagnostic imaging procedures, or it can occur after an industrial radiation incident, maybe malfunctioning of radiation therapy machines or irradiators used for blood products. And also it can happen with nuclear medicine procedures wherein there's going to be errors in the dosage during the administration of radiopharmaceuticals, leading to the excess radiation exposure. And also occupational exposure, wherein there's going to be accidental high dose radiation exposure for healthcare providers or workers due to safety protocol failures. Now, let's talk about the phases of the acute radiation syndrome. So there's what we call as the prodromal phase, which can occur within minutes to hours after the exposure. So this can result to the nausea, vomiting, diarrhea, fatigue, and this indicates that the initial body response to radiation. So this can reflect damage to the GI tract and bone marrow. Now, for the next phase, which is the latent phase, this is going to last from hours to weeks after the prodromal phase. And the patient here may appear well with no significant manifestations, but this can lead to a false sense of security. But the significance here is that internal damage can continue. So the healthcare providers must remain vigilant, as serious complications can happen still. Now, for the illness phase, this can start days to weeks after the exposure, and this can also lead to GI issues, neurological symptoms, and some hematological problems like low blood cell counts. And so the significance here is that this can mark the most serious stage of ARS requiring intensive medical intervention. And so that's the end of our Q&A session for today. So I hope that you found the discussion both informative and engaging. So I need you to remember that reviewing these key topics can significantly enhance your understanding and preparation for the exam. So I want you to take some time to go over any questions you found challenging, and as this will help you reinforce your knowledge. So I thank you for your participation, and I wish you all the best as you continue your NCLEX preparation. Until then.